Here at the American Health Journal, we've heard of a new procedure, often referred to as water lipo. We took our cameras to the Image Enhancement Center in Houston to talk with Dr. James Kern and discovered there is more to it than just removing fat.
I spent many years dealing with patients, having patients come to me and jokingly say, "Oh doctor, I wish you could take the fat out of my tummy and put it in my breast, or you could take the fat out of my tummy and reshape my behind." And of course it was always a joke and we'd laugh as they were leaving. But finally I've learned how to do just that, to do a natural augmentation, a natural reshaping. We can transfer the fat to various places, the breasts, the tush, various places in the body. Sometimes we use it as a filler in the face to soften the lines of the face also.
We asked Dr. Kern about the type of person who would benefit from this procedure.
Generally, they are the type of people who just feel they want to change the shape slightly of their figure. Most commonly, of course, are women who want to enhance in a more natural fashion their breast size. But also we will have some people that come in that want, as I mentioned before, to have the lines on their face soften. Or periodically we have ladies who wish to augment the size and shape of their buttocks.
Dr. Kern told us the equipment used is called a body jet, and this procedure differs from the traditional procedure in that the patient participates.
The patient is not asleep. Although they're minorly sedated with oral medication, they are awake. And the predominance of analgesia that we use is using a solution of xylocaine and normal saline being a mild saltwater solution that's neutral to the body. We administer that basically to kill the pain in the areas that we do liposuction and in the areas of, say, the breast where we administer the fat. After I've put in roughly 1/2 to 2/3 of the fat that we have available, then we will set the patient up. The nurses will bring in a mirror and the patient will be able to look at the size and shape of her breasts, of their breasts, and then I should be able to tell me if they feel I should put the remainder of the fat in this side or that side, basically what they desire. And of course after that's done, then we will lie them back and I will proceed to inject the rest of the fat under their skin. It's a situation unlike other augmentations where the patient can actually be involved in the process and she can give me feedback instead of simply receiving whatever I feel needs to be done and the patient waking up with the results.
We wondered how his patients are responding to the results.
Basically, they're quite happy. They're quite happy. They have received an augmentation or a filler in the lines in their faces. I hadn't mentioned before, we can use it to soften the hands. We can use it to shape the behind. And this is something that is their own tissue. It's not a foreign substance. And it is something that should remain there for the rest of their lives and not shift and not change, but simply be tissue, fatty tissue from their own bodies, simply placed in a different area.